Hi, Assalamualaikum. Today, I want to share several things about dengue cases in Malaysia. First of all, we need to know what is dengue and where is it came from. Dengue fever is a mosquito-borne tropical disease caused by the dengue virus and also known as breakbone fever. Dengue fever began in monkeys and spread to humans as early as 800 years ago. Until the mid-20th century, it was limited to Africa and Southeast Asia. Dengue viruses in infected people and their mosquito vectors, Aedes aegypti, travel throughout tropical Southeast Asia via maritime shipments. The first historical evidence of a dengue-like sickness was discovered in China. They called the disease water poison and said it was spread by flying insects. Dengue fever is spread by the bite of the Aedes mosquito. We need to know that not all mosquitoes are mosquito Aedes. The black and white patterns on the bodies and legs of Aedes mosquitoes distinguish them from other mosquito species. They are active and only bite during the day, unlike most other mosquitoes. Next, how can we know if we have dengue? 3 to 14 days after infection, symptoms usually appear. So, we need to know about these symptoms. A high fever, headache, vomiting, muscle and joint pains, and a distinctive skin rash are all possible symptoms. It usually takes 2 to 7 days to recover. In a small percentage of cases, the disease progresses to dengue hemorrhagic fever, which causes bleeding, low blood platelet levels, and blood plasma leakage, or to dengue shock syndrome, which causes dangerously low blood pressure. Now we know about dengue history and the cause of dengue fever. Next, we need to know how dangerous this disease is to us. Dengue fever is usually a self-limiting disease with a mortality rate of less than 1% when diagnosed early and treated properly. Severe dengue fever has a mortality rate of 2% to 5% when treated, but it can reach 20% when left untreated. Did you know about the history of dengue in Malaysia? Sky provided the first known published record of a dengue outbreak in Malaya on November 15, 1902. From December 1901 to March 1903, he described a dengue outbreak in the northern state of Penang. In November 1962, severe dengue (DHF) was first detected in Malaya in the city of Georgetown, Penang. Dengue fever started spreading into Penang and Kuala Lumpur's urban regions in the 1960s. DHF had spread throughout Malaysia by the early 1970s, posing a serious health threat to the populace. Dengue fever is primarily an urban disease in Malaysia because the main vector, Aedes aegypti, lives close to high densities of susceptible hosts. The states of Selangor, Wilayah Persekutuan Kuala Lumpur and Johor have been particularly hard hit by the disease with high numbers of cases reported. What can we do to prevent dengue fever and help in decreasing the cases? The number of emerging adult mosquitoes and disease transmission will be reduced if the number of eggs, larvae, and pupa is reduced. Community involvement is important to dengue prevention. The transmission rate will decrease or even stop as each household tries to reduce vector density. Several things we can do at home is we need to ensure the cleanness around the house to prevent the breeding of Aedes mosquitoes. We need to discard water holding containers, ensure that the water tank and catchment container lids are closed, and make sure flower pots and containers are watershed at least once a week. Furthermore, the most effective way to avoid mosquito bites is to reduce the amount of exposed skin that mosquitoes can bite on and wear light-colored clothing with long sleeves and long pants when out from the house. While we are staying at home fighting against the epidemic of COVID-19, we can use this opportunity to keep our home clean in and out. This can also help us to keep fit where we can exercise while cleaning and preventing us from getting bite from the Aedes mosquito. That's all from me. Thank you for lending me your ears.